All right, so welcome again. My name is Dr. Orson Morrison, and we are here to discuss anxiety in youth, strategies for treatment and support. A little bit more about me and the center that I run. My name is Dr. Orson Morrison. I'm a clinical psychologist, and I run a center called DePaul Family and Community Services. We're a full service child, adolescent, and family behavioral health clinic located in the Lincoln Park campus of DePaul University. Although we do have that physical space, we have a number of community partnerships all around the Chicagoland area, including Oak Park, which I'll explain our partnership with the district in just a moment. I'm also the father of 2 boys. I also live here in Oak Park, so very familiar with the area and the school system as well. A few years back, we received a grant through the Oak Park Township Community Mental Health Board, specifically geared towards supporting students who are struggling with anxiety, depression, and executive functioning challenges. And we're doing that in a variety of different ways. First, we are providing adults and students themselves education about mental health issues. So teaching adults how to recognize the signs and symptoms of anxiety, depression, executive functioning challenges, as well as strategies that help support youth who are experiencing these sorts of conditions. We're also doing groups, mindfulness-based cognitive therapy groups, a model which has been shown to be effective in reducing symptoms of anxiety, depression, and strengthening that muscle of attention, which is so very common in executive functioning challenges. Those groups are being run at Brooks, Julian, Irving, and Holmes at the current time. We do hope to eventually expand further, but at this time we're only offering at those groups, at those schools. We're also offering care coordination, and this is a sort of a community navigation staff to help link families to needed supports and services in and around the Oak Park community. We also provide individual and family therapy for those families and students that need that extra bit of individualized support. Feel free to reach out to me if you have any questions about those services, or your school principal, if you happen to belong to one of those 4 schools, can give you some more information about the process. We are planning for a return to in-person services for the fall. Of course, we take the lead from the district itself around those sorts of issues. So I'm going to talk a little bit about what anxiety is, healthy versus unhealthy levels of anxiety. We'll look at the brain a little bit, understand the signs and symptoms, what to look for when we talk about anxiety. We'll go over some facts, some statistics around youth and child anxiety. We'll talk about concepts like nature versus nurture. And we'll also talk about some of the cultural issues, the disparities that we see in anxiety, and some of the stigma that we might, that some students and families face around anxiety. Then I'm going to walk through different types of anxiety. There's different diagnoses that fall under the anxiety umbrella, just to kind of give you an idea of the signs and symptoms of each one of those types of anxiety. And I would be remiss to not mention pandemic-related anxiety. We are seeing some increase in stress and anxiety related to living through a global pandemic. And so I'll talk a little bit about that and focus on strategies, how to support our youth in going through conditions like anxiety. So let's start by watching a very brief video clip here.
You know what anxiety feels like. We all do. Everyone experiences anxiety in some way or another. It's something that connects all of us together. Why we feel anxiety and what it really is, that may surprise you. Without anxiety, we'd all be in serious trouble. As soon as your brain senses you're in danger, a little piece of it, called the amygdala, kicks in. It gets your body ready to react. That could mean fight, run away, or shut down. It's called the fight, flight, or freeze response. This reaction goes back millions of years to our distant animal ancestors. Animals whose amygdalae were more sensitive to danger were more likely to stay alive and off the menu. Over millions of generations, this developed into the system we all know as anxiety. So you see, anxiety itself is not all bad. But when there's no immediate life or death threat, and your amygdala keeps telling your body that you're in danger, that's when anxiety becomes a problem. Your amygdala doesn't know the difference between getting eaten and public speaking or failing a test. Human society has only existed for a relatively short time. It's messy and complicated and confusing, and our amygdalae just haven't had time to catch up. So sometimes, when we're in uncomfortable situations, our brains misread the risk and overreact. Our hearts beat faster and we breathe heavily, pulling more oxygen into our bodies. The muscles in our arms and legs tense up and fill with blood. Our skin perspires to cool us down. This would all be great if we needed to fight or run, but instead, we just feel tense and sweaty. Sometimes our minds go blank and we feel like we can't move or talk. That would be great if we needed to hide. Instead, we just feel stuck. When things trigger our anxiety, sometimes we try to avoid them, like our ancestors avoiding a predator. But that can cause problems when those triggers are important parts of life, like going to school or meeting new people, things that won't just give up and go away. So how does knowing all this help? Well, it starts with remembering what's really going on. There's nothing physically wrong with you. It's just your amygdala trying to tell you it thinks you're in danger, even if it gets confused about how much danger you're really in. Understanding why we feel anxiety is an important step in learning to manage it.
All right, well, thank you for watching that video clip with me. It kind of gives us a nice overview and a place to start here. Whenever I work with families, I always remind them that to some degree, anxiety is actually useful and beneficial. And again, from that evolutionary perspective, it's helped human beings survive and get to the point in evolution that we are. The problem is when it becomes excessive or too intense, it can really become debilitating. It can impact our functioning academically, socially, and in other areas of our life. So this graph kind of shows this process of, at some point there's an optimal level of anxiety, a level that helps motivate us, that helps keep us alert, preparing for tonight's presentation. Get a little bit of anxiety. It helps me to sort of sit down and focus and prepare for the talk. But if the anxiety gets too out of hand or too intense, it can really derail a person's functioning. In terms of the brain, there are a few things I just want to go over with regards to child development. When children are born, they're born with a certain number of neuronal connections. And over the first part of life, about the first 6 or 7 years, the brain goes through a lot of growth and development and becomes very proliferate all these different connections in the brain. After that early childhood phase and into that early teen years, the brain goes through something called neuronal pruning. And this is really to prepare the adolescent for more adult functioning. So it's pruning the parts of the brain that are not being used and not being exercised, right? And the other thing that is important here is that myelination is occurring. So the brain areas that are left, those neuronal connections that are left, become covered with a fatty substance called myelin. And this just helps the information transfer very quickly and efficiently throughout the brain. The other thing that's important to note here, particularly important for adolescents, is that adolescents have the most stress hormone receptors in the brain compared to any other phase in development. So adolescence is a particularly sensitive time for stress and anxiety. They're much more prone to react, to be impacted by stress and anxiety in their environment, and pick up the stress hormones that are floating around the system. If I could just remind everybody to mute if possible, that would be great. Thank you. If I can mute from. All right. So the presentation, the brief video clip in the beginning talked about the amygdala. And we know that for children and adults for that matter, whenever we have excessive activation in that part of the brain, this activates that fight or flight response. This is the part of the brain that does send signals to the rest of our body to really gear up for either fight, fight, or freeze. We also know that children with anxiety disorders have a larger amygdala, so that it's slightly bigger than kids who do not struggle with anxiety. The other part of the brain that's very important in anxiety is the prefrontal cortex. So this is right up here in the front of the brain. And this part is really involved in regulating of emotions. So the amygdala is a little bit deeper in the brain. The prefrontal cortex helps to regulate the activation that's going on in that amygdala. And if the prefrontal cortex is over or under regulating what's going on in the amygdala, that can also result in anxiety. The issue with this particular connection between the amygdala and the prefrontal cortex is that it takes a very, very long time to develop. And so it's very common for children to have, difficulty regulating their emotions, right? And so it does take time, through adolescence as well, to finally develop a strong sense of the ability to regulate emotion. So anxiety does look different for every child, but there are some common symptoms: recurrent fears, worries, sleep difficulties, trouble relaxing, irritability, tantrums, anger, crying. These are all examples. Fatigue, quick to overreact, seeking reassurance, and sometimes in extreme cases, self-harm. And so it's really important to know your particular child, the students you might be working with, your own children, how anxiety manifests in them. And we're going to go through some of the diagnostic categories in a moment, which will also help you. Anxiety disorders are the most common category of psychiatric disorders in youth. So out of all the different diagnoses, anxiety, ADHD, depression, anxiety is the most common one. 1 in 3 children will meet the criteria for some sort of an anxiety disorder before the age of 18. So that's a significant number of our children will meet the criteria at some phase of their childhood or adolescence. Anxiety also co-occurs with other diagnoses very frequently. So for example, anxiety disorders co-occur with depression quite frequently, or other behavioral problems like ADHD. We've seen a 20% increase in the prevalence for anxiety between 2007 and 2012. This is some statistics that have been shown pretty much across the board in different research articles. We don't yet know exactly why that is occurring. We do have some hypotheses around that. The increased use of social media, smartphone devices has been one of those topics that frequently comes up in the literature, but we don't yet know. We're also getting better at recognizing the signs and symptoms of mental illness. It's becoming more acceptable to talk about things like anxiety and depression, so that could also be related. I did want to point out here that there was some data that came out last year in 2020 during the pandemic, and we have seen emergency room visits related to mental health increase 24% for ages 5 to 11 and 31% for ages 12 to 17. So this is one indicator that this pandemic in particular has been really, really stressful and anxiety provoking for our children. This is another graph here that shows prevalence rates for conditions like depression, anxiety, and other behavior disorders like ADHD. You can see that for a condition like anxiety, we see a little bit in those early childhood years. 6 to 11, we see even more, but those teen years are really where we see, as kids enter middle school and into high school, we do see the rates really increase. In terms of the literature and research on this question, nature versus nurture, is anxiety genetically caused or is it environmentally caused? It's sort of a combination of both. So we do have a lot of research that suggests that for certain types of anxiety, there is a genetic component. And this is based mostly on twin studies. So when we look at identical twins who share genetic material, we see a very high correlation. If one twin has anxiety, the other twin is likely to have anxiety as well. We've also found genetic markers, and there's been studies looking at topics like epigenetics or multi-generational trauma. So we know that, for instance, Holocaust survivors or people that have gone through the Holocaust and have had children, we have seen that certain mental health conditions actually show up in later generations, and that has been tied to this concept of epigenetics. In terms of the environment, there's several ways to think about this. We can interact, or a child can interact with the environment in a very passive way. So, for instance, a child may grow up in a home where parents are very anxious, right? And so they, they may be predisposed genetically, but also impacted by that environment of anxious parenting. So they're sort of absorbing, growing up in this milieu that is filled with anxiety. There's another term called evocative correlation, and this is when, if a child has anxiety, this may evoke a certain response by the parent, and so our parenting of this anxious child may be impacted. And so we may parent the anxious child in a different way, which then exacerbates or reinforces that anxiety. There's selective correlation, and this is when anxious children will sort of self-select environments that are less anxiety provoking. So if you're a really anxious child or a shy child, you may actually avoid social situations. You may not do, group sports, or you may not try out for that school play. So you're living a very, very solitary life because you're self-selecting certain environments. Another concept to think about is temperament and personality. And when we think about personality, these are relatively stable characteristics that we have throughout our life. They're not really changeable. They're core to who we are. And there are some personality characteristics that tend to be associated with anxiety. If you're somebody that's behaviorally inhibited, so somebody that's just not, so you're a bit more cautious, you're easy, you don't put yourself out there so much, that may correlate with some degree of anxiety. Neuroticism is another personality characteristic, and this is if you're sort of somebody who's really quick to get aroused or difficulty relaxing, you're sort of high-strung. Introversion, another personality characteristic. It's somebody who's shy, a little bit more inner-focused. And non-openness. This is another personality characteristic that is shown to be related to anxiety. I have these two pictures here. These are two people who are, getting ready to swim, right? I have two boys. One is more on the introverted side, and the other one is very more social, gregarious, more active. And watching the two of them actually get into a swimming pool, for instance, is very different. One just runs and doesn't care and jumps. The other one puts his foot in the water, gets his foot wet, you know, gradual, hesitant, cautious, right? These are personality characteristics, and those personality characteristics can also be sometimes associated with anxiety. We'll talk a little bit about parenting and adult-child relationships. With regards to modeling, so our kids are looking at us, they're watching us, they are learning from us daily. And so if we as adults model fear response or anxiety responses, they may learn how to respond to various situations in similar ways than we do. Information transfer, how we talk about threatening or anxious situations, can also exacerbate anxiety. So if we're approaching a particular situation with a lot of catastrophic thinking or catastrophic language, that's going to evoke anxiety in our children. Over control. So if we are limiting our child's developmental growth by not allowing them to make their own decisions, developmentally appropriate decisions, of course, we are communicating to our children that they cannot survive without us. They cannot do well without us, and they need sort of that reassurance or that guidance or that maybe adults involvement in their lives. And so it can also communicate to them that they can't, the world is sort of a dangerous place and they can't manage it on their own. Rejection or lack of warmth, this is another concept that is related to childhood anxiety. So if a child is growing up in a situation where the adults in their life are not warm and are not accepting, this can also impact anxiety. Other environmental influences, we know that trauma, various forms of trauma, adverse childhood experiences, whether they be single events in a child's life or chronic, daily stressors in a child's life, can be impactful, particularly if they happen early on in a child's life and or that are chronic. Those are particularly impactful on anxiety and mental health. Sibling and peer relationships, we know that when children have a close relationship with a peer or a sibling, that tends to create sort of a protective variable in a child's life. So kids who have those strong relationships tend to be less prone to anxiety and other sorts of mental health conditions. Bullying on the more negative side can also impact anxiety. So if a child is experiencing bullying, they're more likely to experience anxiety. Social media, big hot topic in our culture as more and more of our kids get devices and smartphones and are on social media. There's both positives and negatives, and I do a whole talk on the mental health impacts of technology, and we definitely need to take a balanced approach. There are some positives and benefits associated with this, but there's also some potential negatives. On the negative side, there's the cyberbullying aspects. There's also exposure to fear-inducing events. Like if we pull up our social media feeds right now, we can sort of see you know, on repeat, you know, the latest school shooting, the latest political turmoil, and that can sort of create this idea that the world is a really dangerous place. On the other hand, it can impact positive peer interactions. It can create opportunities for connection socially, and so we do need to take that balanced approach. Lots and lots of research on the school environment. As our culture has become more and more academic focused, the pressures on our children have really increased. We start very young nowadays pushing our children, encouraging our children to succeed academically and to begin thinking about college and scholarships and all of these things from a very young age. And this does create stress and anxiety in our kids' lives. Transitions of all sorts, transitions from elementary to middle to high, those are points in a child's life that can bring out anxiety. The importance of adult relationships in a school environment, very, very important. So particularly for certain groups, I think for all kids, it's very, very important to have teachers and adults in a child's life that are warm and accepting and encouraging. But particularly for, historically marginalized or oppressed groups, very, very important. That relationship with the teacher is very, very important. Sense of belongingness too is associated with protective factors for anxiety. Some cultural things I want to just mention here. So in terms of gender, girls tend to have a higher prevalence rate for anxiety disorders. There's we socialize girls and boys differently in our culture, and so it may be that we allow girls to maybe express their feelings more openly. So that may be one reason why girls tend to have that higher diagnosis, is that they're talking more about their feelings. We also socialize boys to maybe express their feelings in a more aggressive way. And so anxiety may be missed, although anxiety may be the underlying cause there. Early puberty is associated with increased likelihood of anxiety for both boys and girls. And this is because, their bodies may be more advanced than their brains are, right? And so that this can cause a bit of a disconnect. The research on race and ethnicity, it's a very, very complex data set, very varied data set. But in general, we see some trends. So ethnic minority youth tend to, are more likely to report anxiety symptoms. And this is because of things like oppression, microaggressions, trauma, systemic racism. Getting a little bit more specific in terms of certain groups, African-American adolescents, higher rates of general anxiety, PTSD, social anxiety, and fears of authority figures, police officers, teachers. Latino adolescents, higher rates of separation anxiety. And from a cultural perspective, there's been some research suggesting that the ways in which members of certain Latino groups express their anxiety is more through their body. So headaches, stomach aches, those sorts of symptoms. Asian American adolescents, there's very limited studies on this, but higher rates of anxiety if a parent or parents adhere to very traditional cultural values where emotions tend to be suppressed and not talked about. This can, particularly in a more Western culture context, can create some anxiety for those children. Sexual orientation and gender nonconformance, kids who are LGBT or on that spectrum, or non-conforming in some way in terms of gender or sexual orientation, tend to experience higher levels of anxiety. This is again related to more environmental lack of acceptance in the family, lack of acceptance at school, etc. And the range of other sort of cultural factors, socioeconomic status, living in poverty, regardless of race, immigration status, acculturation, kids that have immigrated or who are in the process of adjusting to a new culture, growing up in a culture that has a lot of stigma around mental health. Just cultural ideas about mental health and anxiety. And this concept of intersectional identity. So, being a female and being LGBT, like when those identities come together, there may be a cumulative effect around stress and anxiety. So I'm going to talk now about the different types of anxiety. There's so many different types of anxiety, and so it's important for us to think broadly about this. So separation anxiety, this is something that we typically see in those early childhood years. Developmentally inappropriate or excessive fear or anxiety separating from a parent or caregiver. And that these symptoms persist for at least 4 weeks. So when we talk about diagnosis, we need to see that the symptoms have been there for a certain period of time, and they're causing distress in some way. They're causing, interpersonal distress, academic stress, stress on the job, those sorts of things. So many of these diagnoses will have these sorts of definitions. Selective mutism, and this is when there's a consistent failure to speak in specific social situations, where there's an expectation to speak, like in class, like responding to teachers' questions or giving presentations, those sorts of things. So a child may be mute in the school situation, but completely verbal at home. Specific phobias. So this is when you have a specific phobia of a specific thing, like flying or fear of heights. And that those symptoms are present for 6 months and again are impairing your functioning. So not able to maybe go to a certain place, not go to school, those sorts of things. Social anxiety. Anxiety about one or more social situations in which the child is exposed to possible scrutiny by others. So really some child is worrying about what are people going to think of me? They're looking at me in a certain way. They're judging me, having these sort of ruminating thoughts in these social situations. And the symptoms are present for 6 months. Panic disorder. This is a reoccurrent, unexpected panic attack. And a panic attack is just a surge of anxiety, a surge of intense fear, really peaking within a very short period of time. And then the person worries, they get anxious about having another panic attack. And then they sort of avoid situations at all costs to avoid or prevent from having a reoccurring panic attack. And that needs to be present for about a month. Agoraphobia. This is a marked fear and avoidance of going out, going to open spaces, being in crowds, leaving the house, public transit, etc. And you need to have 2 or more of these in order to meet that criteria. Generalized anxiety. This is excessive worry, more days than not, about a number of events or activities. So maybe you're a child or have a child who has a lot of different worries about parents' health, about school, about friends, different areas of one's life for a period of 6 months or more. OCD, obsessive compulsive disorder. So this diagnosis has 2 components, the obsessions and the compulsions. So obsessions are sort of the thoughts, these reoccurring thoughts, persistent, intrusive, unwanted thoughts. They just keep coming up. Images, thoughts, and they produce anxiety, they produce stress. And in order to cope with those thoughts, those intrusive thoughts, we see compulsion, so repetitive behaviors that the individual feels will reduce those thoughts or eliminate those thoughts. So needing to let's say, touch a certain object 10 times. They develop these sort of compulsions as a way to cope with that anxiety. And on the more severe end, when we do see clinical anxiety, we see a lot of maladaptive coping. We see passivity, avoidance, avoiding going to school, avoiding talking to friends, anger, substance use, over, under eating, academic, school refusal, relationship difficulties, over-reliance on technology, and self-harm. We see all of these sort of maladaptive coping strategies. let's see here. I'm going to pause just for a moment to see if there's any questions in the chat, or if anybody wants to unmute themselves and ask a question, you may. And if not, I will just keep going. Great, so let's keep going. And then if there's any questions, again, feel free to put them in the chat, and we'll go over them in the end. Anxiety during COVID-19, we've seen there's a lot of things related to COVID that have impacted our anxiety and stress. So we need to be more vigilant about our body proximity, social distancing. We've been in a period where we've had to quarantine for lengthy periods of time. And so we haven't had very frequent in-person social interactions. And so we're no longer used to socializing in that way. There's research to suggest that the longer a quarantine period goes on, the more likely we are to have anxiety about re-entry, about returning to those previous sort of social interactions. We've also had stress related to school and work modification. So, increased reliance on technology, for instance, and the stress associated with remote learning and parenting from home and having to support kids who are remote learning. Towards the beginning of the pandemic, we saw sort of reduced access to goods, services, system level supports. Health-related anxiety, so having symptoms of COVID will bring up anxiety and stress in people. We've also seen families going through a lot of financial losses and stresses related to this time. Access to information has been confusing, disjointed, conflictual at times, and that causes anxiety. We've seen, of course, loss and grief related to COVID. People in our families or friends or community members who have lost their lives related to COVID. Other social factors, election anxiety, systemic racism, all of these other social factors have occurred also during this time, which have exacerbated our anxiety and stress. So what can we do in terms of supporting our kids? So we can communicate. We need to recognize the signs and symptoms of anxiety. We need to take a more listening approach instead of lecturing our kids. We need to validate our kids, use that validation language. Recognize that it has been a challenging time. It is a challenging time. I see that you're feeling anxious. Mirror those feelings. Be vulnerable with your child. Model, again, back to that slide about parental modeling. Let your kids know that you're stressed too, that you're feeling anxious too, and this is how you're coping. I'm feeling anxious right now. I'm going to go for a walk around the block. So just destigmatizing the concept of stress, the concept of anxiety, and model for your children how you take care of yourself. Independence, so promoting developmentally appropriate independence. We need to gradually encourage our children to make their own decisions, of course, with our guidance, with our support, in a way that's developmentally appropriate. Supporting peer interactions, relationship development. We can sometimes, as parents, that can be anxiety provoking to see our kids kind of, taking risks or, doing things without our full supervision or support, but gradually letting go and gradually allowing them to build that confidence and healthy ways of being independent. Help your teen or your child take healthy risks to try new things. The pandemic has been an interesting time here where we've been at home a lot, and it has been an opportunity for some families to try new things and for some children to try new interests or explore new things. So definitely encourage that. Let's see. Physical health is very important. Anxiety is a very body-based condition. heart racing, muscle tension, fatigue, these sorts of things. So the best you can really encourage your child to have healthy sleep practices, getting enough sleep, nutrition, physical activity, balanced social media use. So I often think that this question, how is this serving my child? That's sort of the driving question that I think parents should be using when they're trying to decide about technology or social media use. Is it a way for my child to maintain, develop, explore relationships, connections? Is it a way to learn, to enhance knowledge, to stimulate the mind? Is it a way that they're using their creativity in a very active way? Or are they just sitting passively watching YouTube videos by themselves? So there's a very different way of using technology. Also being mindful of, is this technology displacing other important aspects that are developmentally needed? So sleep, exercise, social interactions. If the technology is getting in the way of those things, then that could be problematic. Creating screen-free downtime is very important. So I do again give another presentation specifically on mental health and technology where I go into a lot of detail here. I could honestly talk about this topic for several hours. So when to seek professional help? Again, when there's an impairment in functioning, when you see your child's grades going down, when their social relationships are really struggling, when you've seen prolonged changes that just haven't gone away over a period of weeks. Those are potential signs that your child may need some help. And talk with your child about what help looks like, involve them in the decision. Of course, that depending upon their age, they may be wanting to be more and more involved in that decision, particularly older kids. And become involved in the treatment too. So, learn the strategies and skills that your child's therapist is working on with your child so that you can help support and transfer those to the home environment. The Oak Park Township has this Health Connection Hub website. It's a website that is available if you're looking for certain resources in the community. So you can use that as a research tool. You can also speak to your primary care physician or pediatrician. And many providers are still offering services via telehealth, but a lot have started to do in-person services. There's also this texting line that the Oak Park Township has sponsored where D97 students can text and get connected directly to a licensed mental health professional who can help them through moments of crises. I do want to talk a little bit about some of the treatment that is available. And from a research perspective, sort of the gold standard anxiety treatment is exposure-based cognitive behavior therapy. So this is when we set a goal and we break that goal down into smaller steps, and we gradually expose ourselves to increasingly anxiety-provoking situations. So let's say we're afraid of a dog here, right? So we're gonna start by perhaps looking at a picture of a dog, getting comfortable with that. And then we're gonna move on to watching a cartoon of a dog show, right? So this is just an example of how we might set up kind of an exposure-based therapy program. The other strategy here is called cognitive restructuring. This is another cognitive behavioral therapy tool. And this is about putting your thoughts on trial. So recognizing those worry-filled thoughts, those stressful thoughts, and learning how to, in an objective way, look at the pros and cons. Let's look at the facts here. Let's look at the evidence for and against this really problematic thought that you're having. And it just helps get out of those sort of really extreme black or white sort of thinking patterns that really exacerbate anxiety. And it replaces those thoughts with a little bit more of a rational approach. Some more treatment considerations. So rewards is another feature of CBT. And important for parents to really reward effort, not necessarily the end goal, but even moving small steps towards that goal is really important to praise and to point out and to reward. Special time together is also, again, associated with strengthening that relationship between an adult and a child. And it doesn't have to be excessive amounts of time. It can be 10 minutes a day playing Uno or going for a walk around the block. Just spending that special quality time with an adult can be really, really helpful in reducing stress and anxiety in the child. Another concept here is radical acceptance versus change. And this comes from a model called dialectical behavior therapy. And it's really looking at what are the parts of this anxiety-provoking situation that can be changed and that can't be changed. And so learning how to differentiate that can also help with anxiety. So learning how to accept the things that I have absolutely no control over, right? And so in that sense, the strategy is really, validating, yeah, this does suck. COVID-19 sucks. It has impacted our lives in such and such a way. But there are ways in which we can have a happy life, right? So accepting that this is our current reality. But then on the other side, what can we change? What do we have control over? So we do have control over, maybe what we do with our free time, or who we talk to, or how our exercise regimen. So there are these things that we can then put our attention in and we can focus on in more of a problem-solving way. In terms of school-based supports, we're thinking about working with our school staff. If a child has clinical anxiety, they may benefit from a formal 504 plan, for instance, where there's accommodations and social work support. So that would be something to consider if your child has a sort of chronic history of anxiety and has had a diagnostic evaluation, for instance, where they've documented that. Identifying a support person in the child's building that is comfortable to the child, that can be a go-to person is very important. Educating the teaching staff. So if you have a child with anxiety, making sure that the teachers know that this is something that your child struggles with, and these are the signs and symptoms to look out for, and this is what my child responds to. So that school-parent collaboration is super important. In terms of medication, I'm not a psychiatrist, so definitely would recommend talking to your primary care physician or psychiatrist if you have one with any specific questions about medication. But just in terms of the research, medications called SSRIs, selective serotonin reuptake inhibitors, are the class of medications that have been most studied in childhood mental health related to anxiety and depression, and has been shown to reduce anxiety symptoms. And the approach would vary depending upon whether your child has a mild form of anxiety, moderate, or severe anxiety. And so probably the first course of action that I would recommend, and most therapists would recommend, is that for more mild to moderate cases, you may want to just try therapy first. And if that doesn't help, then perhaps considering medication. But for more severe forms of anxiety, you may want to try immediately with a combination approach. Again, consult your pediatrician and child psychiatrist. Oops, sorry, this didn't turn out very well. But some strategies for pandemic-related anxiety. This should, let me see if I pop off the, there we go. We want to be communicating that our life is predictable. I mean, we're living through such uncertain times right now. And so the more that we can build in routine, do the things that are predictable, that definitely helps to reduce anxiety. So I have a couple pictures here of sort of summertime routines here in the Oak Park area, like Thursday night out or going to the farmer's market to get donuts on Saturdays. These are sort of routines that can be built in to a child's life, a family's life, just to sort of build that predictability. Maybe you go on a family walk once a week in the evening. You know, building those small rituals in can go a long way. Social connection, you know, even if it is via technology, can be helpful. Making a go-to list of, you know, sort of activities that a child can do in moments of boredom. You know, if they're stuck in the house, if they haven't been able to go be with friends, that can be helpful as well. All right, so let's see. We're getting on near the end of the presentation, and I'm going to skip through a couple slides here just for the sake of time. I do want to talk about mindfulness. Our grant with the Oak Park District is very much centered on the concept of mindfulness, and this is also a technique that's been shown to reduce anxiety in youth. And mindfulness is really about learning how to pay attention at the present moment as things are, right? Without judgment, without the labeling of experience. And the benefits are that we learn how to slow down. You know, we learn how to slow down that stress response before we act. Okay? It just gives us a little bit more space to choose how we want to respond in a given moment. And we are going to end with a brief mindfulness activity, but just to give you a difference here, when we're in that anxious mode, we're going to be very biased. Our attention is going to be focused on that potential threat, right? We're going to be focused on maybe something that happened in the past or something that we're anticipating will happen. We're taken away from the present moment. We're in that rumination, we're judging, we're thinking critically. We're in the mindfulness mode, we're not being biased in our attention. We're really just focusing on the moment as it is. We're getting a little bit more space and distance from those anxious thoughts. We're not our anxiety, right? We're more than our anxiety. Our anxiety is just a little part of who we are. Okay, before we do the activity, I'm just going to see there's a couple pieces of chat that just popped up. Yes, slides and recording will be available at the end. So for the next few minutes, I'm just going to invite you to participate in this brief mindfulness activity. So if you could kind of get into a comfortable position and just follow along. Taking a moment to get into a comfortable posture, one that helps you to feel alert and awake. Closing the eyes if you feel comfortable, and bringing your attention inward. Focused on the body sitting, checking in with and noticing what is present regarding thoughts, emotions, and body sensations. This is an opportunity for you to become aware of what is going on for you in the present moment, in the here and now. And once you are aware of what is going on now in thinking, emotions, and body sensations, gradually shifting your attention to the physical sensations of breathing, using your heart as an anchoring point. You may find it useful to place your hand on your heart while attending to your breath. Notice the expansion of the chest and the abdomen as you inhale, and the deflation as you exhale. Just be with your body breathing for a moment. Finally, shift your attention outward to the entire body around your breath, to any and all sensations. The temperature of your skin, the feeling of clothing on your body. The best you can, bring a sense of openness and receptive attention to your experience in this moment. Allow your attention to expand further into the room, noticing any sensations, sounds, smells, for example. Continue to allow your attention to expand further outside, to your neighborhood, to your town, region, and country. Allow your attention to reflect upon our global connectedness to one another in this moment. And when you're ready, gently bring your attention back to the room. Open your eyes, but hold on to that sense of openness and connectedness. All right, thank you so much for participating with me. I hope that that was a nice way to end the presentation and just a bit of a reprieve from our busy days. I do have a very, very brief evaluation that I will also email you at the end, but if you are able to pull it up now, that would be great. I'll put it also in the chat, perhaps. And I will take some questions now if anybody has any. Let's see here. Oh, you're very welcome. And yes, I will definitely send the slides and the recording to everybody as well. Amy asks, any suggestions for increasing nutrition or activity without nagging? Yeah, it's a challenging one. As a parent, I can totally relate to that. But, you know, I think perhaps offering some choices, if possible, maybe sitting down once a week and getting the family to chime in on or make a list of like meals that they want to make or, you know, to have over the course of the week, just sort of creating more of that sort of community decision-making can sometimes help. I know that that's helped with my kids sometimes with food. You know, doing things with your children, I think is another way in terms of increasing the activity, or maybe planning with some other family members or other families in the neighborhood to maybe coordinate some activities. That would be sometimes useful. Hope that helps. Thank you, Karina. Any other questions? Wonderful. Well, feel free to email me too if you have any other questions that come up later, or you know, have any questions about our program too with the district. That would be great. Well, it's been my pleasure to speak with you. I hope that you're all enjoying your summer, and that you continue to have a safe and enjoyable summer, and look forward to seeing some of you in the fall. Have a good night.